Hi, my name is Lindsey Johnson, and I'm recording my mock interview.
How has your undergraduate research experience, if any, better prepared you for a medical career?
So, my research experience was conducted at Children's National Hospital in Washington, D.C., in their emergency department. I was doing clinical research for them, and the research that I focused on was febrile seizures, as well as the other different types of seizures that came into the ER. And so that has prepared me for my medical career because I've had the opportunity to not only interact with patients and parents, but I've also had the opportunity to interact with doctors as well, and physicians and PAs and nurses. Having that opportunity, I was able to not only talk to patients and learn, a little bit more about them and get their consent and learn how to read charts, and as well as who's coming into the ER for what reasons. I was also able to interact with physicians and talk to them. I also had the ability to shadow physicians as well and see how the ER works within a child setting, as well as different locations of ERs within Children's National. So having those opportunities, I was able to better see like what emergency medicine looks like, as well as what being a physician looks like, and how I can interact with patients and their parents, and how I can be well rounded as a physician, learning how to not only have bedside manner, but as well as talking to the doctors and getting to know a little bit more about the patients and how they come up with diagnosis.
What travels have you taken and what exposure to other cultures have you had?
So I've traveled outside of the country to Lima, Peru, where I've had the opportunity to do a medical campaign for 2 weeks in the Pachacutec area. Having that exposure to the different culture and the language barrier that they had in Peru, doing the medical campaign was a great exposure to me, because it taught me how to step outside my comfort zone to not only help people who needed help for medicine, but as well as learn how to communicate with people that I could not communicate with at first, and started to pick up little words and things of that nature to better communicate. Being in a homestay as well, I was exposed to the culture of the Peruvian family, and how they work differently from an American family, how they go out and do things, and they go to different parks and stuff. And being exposed to just how Peru works was very eye-opening, because it made me not only humble myself for what I have here in America, but it also made me see that the cultures are very important to know about, because I would have never known that in Peru, the way that you talk to the families, you talk to the father first, not at the patient or at the child.
What excites you about medicine in general?
What excites me about medicine in general is the unknown. I like the idea that there's people coming in who have symptoms that you don't know what they are. There's diagnoses that you don't really know, but you have to do more research. The unknown of finding out new ways to do procedures, or how to better prepare people. I like that unknown of making sure that we don't know what's going to happen in the future of medicine, but we also don't know what's going to happen in a couple of days of medicine, because medicine is always evolving and changing, and there's always that evolution of something new coming out.
What do you feel are the social responsibilities of a physician?
I feel like the social responsibilities of a physician is to keep their patients informed, help their patients to be knowledgeable of what's going on with their body specifically. I think it's important for doctors to not only help their patients have health literacy, but as well as to keep them informed of what they need to know about their health themselves, and different factors that can harm them as a community as well. And within the community that they're working on, they need to be able to express to the community that these are factors that predominantly affect you guys, so these are things that you need to know. I think it's the social responsibility of a doctor is to give out information to their community and their patients, because it's important for them to not only keep their patients healthy, but the community that their patients live in as well.
How would you feel about treating a patient who tested positive for HIV?
I don't think treating a patient who tested positive for HIV is any different from treating a patient who does not have HIV. I think it's there are precautions that you still have to take with any patient, because you do not want to transmit any type of diseases from yourself to them or them to you, but you also want to go about and treating that patient with kindness and empathy, because now they have this disease where they might be scared, they don't know how they're going to handle it, they don't know what they're going to do. So now it's in your best interest to not only assure them that it is treatable and that there are other things that they can do to help themselves, but that they can make it through if they are a strong person, and that they will, as long as they continue to do and stay on a regimen of whatever that they need to do to beat HIV.
If you're a woman, how has your gender impacted your decision to pursue a medical career?
Um, Being a female has made it so that I want to pursue medicine because I want to be able for girls to have, or for somebody to have somebody they can look up to them who looks like them. Not having a doctor who doesn't fully look like me, who might be black but is a male, is hard because, you might not be you might not be as comfortable with that doctor, you might not, having a male doctor is hard sometimes, but as well as having a female doctor who is a woman, they're better equipped to advocate for you. They know what you might be going through. They can understand a little bit more of what's happening to you because it's also happened to them, or it has happened to them, or they have people who they've talked to who've had similar experiences. Being a female in medicine makes it so that you can, talk to your patients, and your patients can be more comfortable with you because a lot of people might not be as comfortable opening up to a man as they would as a woman. A woman is kind of also like a security because it also makes people a little bit more comfortable. But as well as it's just, I feel like being a female in medicine is important because we need more representation of females as well as black females in medicine.
Pick any specific medical school to which you're applying and tell the interviewer about it. What makes this school particularly desirable to you?
So I'm applying to Hofstra University, their medical school, the Donald and Barbara Zucker School of Medicine at Hofstra University in Northwell. Their school, I like their school because it is very community oriented. They are very big on working together. They have different cases called Pearls cases where they work together in small groups. They're smaller in size, as well as they have resources for their students. The class size is small enough that they can have instructors within their Pearls group work with them. They work towards getting their students EMT licenses when they first get there to Hofstra. I think it's important to not only push your students to have an MD, but also another skill set that they can have. And having that EMT skill set is I think a very good, that Hofstra passes on to its students. I also like the fact that Hofstra has pushed to up its diversity for its students, because that's important for me, as well as seeing more diversity in my classmates as well, because we all come from different walks of life, and medicine takes on very many facets of the world. And medicine is something that's everybody has to go through. Patients have to come in for different things, so having diverse classes and diverse people in medicine is important. What's the second part of the question?
What makes this school particularly desirable to you?
The school is desirable to me just because of all the things that it has to offer. Their EMT certification that they push on their students, their community-based learning style, their small class sizes. I think it's important that, for me especially, to not be just a number within a class, is to be a name, a face. Somebody can put it to, a professor can say, "Hey, Lindsey," or they can ask, I can come into their office and ask them questions, and they go, yes, I know this X, Y, and Z, and actually have a conversation with somebody and actually have a relationship with your professors, because that's important to have.
Discuss your decision to pursue medicine. When did you decide to become an MD, and why?
So I decided to become an MD after my trip to Peru, because I saw that there was a miscommunication. There was a distance between medicine and underserved communities. And I know that even if we are in a foreign country, we're not in the U.S., I know that in other places in the U.S., there are places that are underserved that do not have medical access as readily as I do in my community and other communities. So I saw that as a push for me, as a challenge for me to become an MD, to then make those accesses to medicine available to those communities that do not have, easy access to a doctor, as well as not only providing access in underserved areas to medicine and giving them the information that they need. I'd also want to offer some type of mentorship to younger people in those underserved communities and show them that they can do other careers. Even though I would push for medicine, they can also go in, to education, to the environment. They can do other things than just stay within the community. They can also go out to the community and help their community, but also come back and get a degree to better help their community. My push for medicine is more based on the fact that I want to serve these underserved communities and my passion for serving those communities to better help them with any disparities that they also might face, because that is a big thing in underserved communities, is that they're put at a disadvantage with some of the disparities that they do face. Last question.